Hello, bonjour.
Bonjour, alors tout va bien, nous sommes tous prêts et vous pouvez commencer si ça ne vous dérange pas.
Okay, we can start. You can see my screen?
Comment?
Can you see my screen?
Yes,
Yes,
yes.
good, good. Also, first, I would like to thank you, the entire scientific committee, and in particular you, Professor Mustafa Badeldin, for inviting me to present one of the last innovation in ENT robotics, the ROBOTOL. Let me start by introducing COLLIN, just the company behind this technology, of course. This is okay. Can you see my? Okay, so this is just COLLIN is a French company. So the existed for over 200 years, and for the past 40 years, we have been 100 focused in developing advanced solution for ENT surgery. So COLLIN design and manufacture its own equipment, including surgical navigation system and the ROBOTOL. So the ROBOTOL dedicated for ear surgeries, and we'll go in details in this project. So the development of the ROBOTOL began in 2005 as a collaboration between Professor Sterkert's teams in Paris and COLLIN's engineers. From the start, the goal was to create a robotic solution to address natural imperfection of the human hand. This is the main topic. So, indeed, rotary movement, so tumblement, no control movement, drift. You know that the previous speaker speak about the challenge we have with the hand. And we have to manage with an imperfect hand, can say like that, millimetric structure or micrometric structure in pediatric and in adult patients. This is, you know perfectly that. How we design the robot? We base the reflection on four key considerations. First of all was modeling the environment around the patient. We needed to take into account all the equipment present in the operative room to ensure that the robot could integrate easily into the surgical workflow. That was the first point. Second consideration was modeling the environment inside the patient. This allowed us to design the robot so it could access all parts of the middle ear and inner ear, ensuring versatility for different types of ear surgeries. Third was measuring applied forces. It was essential to calculate the force exerted during surgery to design a robot that could perform with both precision and safety. And last but not least, defining the motor resolutions. This determined the robot's level of precision, which was achieved exceptional 5 micrometers in linear resolutions and 0.3 degrees in angular resolution. Means we had this robot, you have the picture here and the image. So where we can use the ROBOTOL, we can use the ROBOTOL in all the parts in the ear. We have different arms, 3 in total. One is an arm for passive instruments, another one for active instruments, like a stillet to put in place electrode array, like forceps, like in the future syringe for injection of drugs. And we have another arm for optics. So, thanks to the ROBOTOL, we can perform surgeries in the middle ear and in the inner ear. So to summarize these 3 arms, 1, 2, 3, and how these 3 arms that the surgeons has to decide which arm he will use at the beginning of the surgery, of course, because only one arm can work at the same time, and how the robot is driven thanks to the space mouse. This is the driver, you can see it in the screen. This is the driver to pilot the arm with the level of precision we spoke about a few seconds ago. We have a range of instruments. Here you have the range of passive instruments like friction, laser, welder, knife, etc. So to perform all the surgeries needed. We have active instruments. You can see some stillets for cochlear implantation. So the ROBOTOL can handle all as an electrode array brand. And we have other tools like forceps, as I said, for different surgeries. So consider the robot is a tool, and is the surgeon has to choose which arm and which tool he will use. It's another student with the surgeon. About the active instrument, Professor Topsaka just spoke about that, about the speed insertion is a crucial point for the cochlear implantation. Thanks to the instrument, active instrument, the surgeon can put the electrode array at a dedicated speed, 1.1 millimeter per second seems the right speed. So we can achieve this speed of insertion. And of course, you have seen that the constant insertion speed is another key point. The robot can achieve this point. The goal is to avoid any translocations and respect of all the anatomical structure of the cochlea. In some numbers, thanks to the robotic system, you can reduce by more than 50% of the force into the inner ear, and can reduce close to 80% the force variability into the inner ear. So for the patient, surgeons, the team, the goal is to have a safe procedure, precise procedure, and to have better outcome patient. This is the goal. We have some data in different teams in the world that show this is we can achieve a better outcome patients. Of course, some other studies are ongoing. For the other arm of the ROBOTOL, we can hold optics with different angulations, and thanks to that, the surgeon could have two hands free to perform surgeries into the middle ear through the canal and have a good view, as you know. Here to summarize, a small video. You see the space model? So just in terms of studies so far with the ROBOTOL, we have 24 studies so far, and in these studies show that there are less electrode translocation, better residual hearing. For endoscopic surgeries, the studies show that it's safe, and for the other study, we can say, and we can the studies showed that thanks to the robotic system, you can reduce the learning curve in certain surgeries, like endoscopy, for example. The future is a good question. What is the future of this technology? Of course, we'll see that in the few next months, few next year, but we are thinking, the engineer with the surgeons, we are thinking about new features, new indications. Of course, intelligence artificial is in our mind to improve the robot. For augmented reality, this is another topic we are working on, for example, for the endoscopic surgeries. And we are working harder in the injection of additional drug. You know about the genetic therapy, and so now we could have solution with the robot to inject this therapy. The forceps is one of the last tool dedicated for the ROBOTOL and designed by the engineers. So now, thanks to with the forceps, you can perform different type of surgeries. That you know that, and I will go to the next step. Of course, we could ask which type of electrode array we can put in place with the ROBOTOL. We can put in place all the electrode array, straight electrode, and perimodular electrode. Last but not least, ROBOTOL now is connected to the navigation. What does it mean? We can have pre-planning CI surgeries to design or to align the robot with the ideal insertion axis. This is a very important topic for the robotic system. This is an illustration about how the robot and the navigation can fit together and which type of images you can have and how this new feature can help the surgeons. I spoke about the future. Of course, injection or gene therapy or cochlear sampling tools are ongoing, and the engineers are working harder on these other topics accordingly to the needs of the surgeons. Just to give you an overview about the current users, some of them are in the room with you, or in France, in Germany, in Italy, in Czech Republic, in China, and in Australia. There are users for cochlear implantation, for endoscopic, and this is here some of the current users. Thanks for your attention, and if you have some questions, I will be happy to answer. And of course, you have, as I said, some users close to you, and you can have discussion with them about the utilization of the ROBOTOL.
Thank you very, very much for sharing this wonderful talk with us.